Older people should know. The 8 most important warning signs of silent kidney failure. Sometimes, the most dangerous thing is what happens quietly and silently. This is especially true for an organ like the kidney, which has no sensory nerves and therefore rarely sounds a clear alarm. But precisely because it is so silent, the body often only shows strange symptoms when the kidney is already crying out for help. These signs can easily be overlooked if you're not attentive. For older people, this is particularly dangerous, as many symptoms can be mistaken for normal signs of aging. However, recognizing the signs correctly allows for early action to protect the kidneys before it's too late. Here are the 8 warning signs of silent kidney failure. Let's explore them together. Warning sign 1. Unusual urine, the first clear signal from within. A often overlooked change is the color and consistency of urine. Many people simply think they didn't drink enough or ate too much salt when their urine is dark. However, it is scientifically proven that changes in urine are one of the earliest signs of kidney problems. A healthy kidney retains proteins, a vital substance for the body, and prevents them from entering the urine. In damaged kidneys, especially when the filtration membrane becomes leaky, proteins pass into the urine, resulting in foamy urine, similar to whipped egg whites. If the urine is red, pale, pink, or dark, like strong tea, it could indicate blood in the urine, a clearly abnormal sign. An altered urine odor, musty, fishy, unusual, also suggests that the kidney is no longer filtering effectively. A study by the International Center for Nephrology shows that over 45% of patients with chronic kidney failure discover protein or red blood cells in their urine by chance during tests. Without examination or careful observation, this first warning sign is easily missed. So, do not ignore even the smallest changes in your urine. Warning sign 2. Persistent fatigue, an internal exhaustion no one sees. Have you ever felt tired after waking up, despite sleeping 7 to 8 hours? Or were you out of breath, dizzy, or lacked energy for housework after a short walk, or didn't even want to get up? Many attribute this to age, the weather, or lack of exercise, but the cause could be impaired kidney function, which no longer cleans the blood properly and disrupts the production of hormones for red blood cells. The kidney produces a hormone called erythropoietin, which stimulates the bone marrow to produce red blood cells. In weakened kidneys, this hormone decreases, leading to fewer red blood cells and, consequently, anemia. Anemia causes oxygen deficiency in the body, resulting in persistent fatigue, dizziness, memory loss, and lack of interest in activities. It's an internal exhaustion that no one sees, but you clearly feel. A study involving over 20 older people with chronic kidney disease found that 68% experienced persistent fatigue without knowing their kidneys were the cause. This symptom is often mistaken, leading to delayed diagnosis. If you feel unusually tired despite eating and sleeping enough, have your kidney function and hemoglobin levels checked immediately. Warning sign 3. Edema, the silent accumulation of water and salt in the body. Perhaps you've woken up with swollen eyelids, or noticed that your ankles or hands feel swollen and heavy, especially when wearing shoes or after standing for a long time. Many think this is due to joint problems or an awkward sleeping position. But if it happens regularly, especially in the morning or after prolonged sitting, it could be a quiet signal from your kidneys. A healthy kidney regulates the amount of salt and water in the body. When kidney function is impaired, water accumulates in soft areas like eyelids, hands, feet, and ankles, leading to edema. These swellings are often painless, not warm, and subside slowly, unlike joint inflammation or vascular damage. According to statistics from Bach Mai Hospital in Vietnam, over 55% of patients admitted with generalized edema due to kidney failure initially thought it was caused by heart problems or excessive water intake. Correctly identifying the cause of edema can speed up diagnosis by months or years. Don't be careless if your eyelids are swollen or your shoes suddenly feel too tight. Consider this a valuable signal to have your kidneys checked. Early detection offers many opportunities to preserve kidney function. Warning sign 4. Shortness of breath, when the lungs have no room for air because the kidney is weak. Have you ever felt a constricting sensation while sleeping on your back, struggled to breathe, or felt something pressing on your chest? Or were you out of breath and dizzy after climbing just a few stairs? Many immediately think of the heart or lungs, but an often overlooked cause is a weakened kidney that causes fluid buildup in the lungs, hindering breathing. When the kidney is weakened, excess fluid cannot be excreted and accumulates in the lungs, a condition known as pleural effusion. This leads to difficulty breathing deeply, rapid fatigue during movement, and even a sensation of drowning without physical exertion. Additionally, anemia caused by weak kidneys worsens oxygen deficiency, accelerating the heartbeat and shortening breath. A study by Johns Hopkins University, USA, shows that nearly 40% of patients with stage 3-4 kidney failure experience nighttime shortness of breath without suspecting the kidneys as the cause. This often leads to a late diagnosis when the kidney is already severely damaged. If you experience shortness of breath at night, especially when lying down or after dinner, don't just attribute it to age or digestive issues. The kidney affects the lungs in a silent but dangerous way. A little timely attention can prevent a chain of serious complications. Warning sign 5. Dry and itchy skin. When toxins become visible from the inside out. Have you ever felt a tingling sensation all over your body without insect bites, allergies, or rashes? Or was your skin dry, scaly like fish scales, especially on your forearms, back, or abdomen, and itched unbearably at night? Many think it's dry skin due to age or the weather, but it could be an early warning sign of kidney issues. The kidney not only filters blood, but also balances minerals like calcium and phosphorus. In weakened kidneys, this balance is disrupted. Calcium deposits in the skin, while high phosphorus levels in the blood irritate nerves, causing intense itching. Additionally, unexcreted toxins like urea and creatinine lead to rough, dark, dry, and irritable skin. Doctors at Ho Chi Minh City University of Medicine report that over 50% of patients with chronic kidney failure experience dry skin and itching all over the body, especially at night, leading to sleep disturbances, exhaustion, and emotional stress. This symptom is often mistaken for skin conditions, leading to incorrect treatment because the true cause lies in the blood. Moisturizers, drinking more water, or herbal baths may help, but if they don't work, consider kidney function. The skin is not just a barrier, but a mirror of your internal health. If it's dry and itches intensely at night, check your blood urea, creatinine, and phosphorus levels immediately. Warning sign 6. Metallic breath odor and loss of appetite, when eating becomes a burden. Have you ever noticed that food no longer tastes good or felt a metallic, rusty taste in your mouth? Perhaps you felt nauseous or had an urge to vomit during meals? If this persists, it not only affects your weight but also your mood and causes further disturbances. Few suspect that the kidney could be the main cause. When the kidney fails to filter toxins like urea and ammonia, these accumulate in the blood. They affect the brain, altering the sense of smell and taste, making food taste metallic, bitter, or bland. Additionally, these substances irritate the stomach, causing nausea, bloating, or a feeling of fullness. This explains why many affected individuals find eating unpleasant, lose joy in food, and rapidly lose weight without knowing the cause. Japanese studies show that over 60% of patients with stage 2 or 3 kidney failure experience loss of appetite, nausea, and metallic breath odor, even when other values appear normal. This early but often ignored symptom goes unnoticed. Pay attention. If a familiar dish suddenly tastes off or your breath smells unusual, have your kidney function checked. Altered taste means there are too many toxins in the blood and your kidney urgently needs help. Warning sign 7. Insomnia, restless sleep, or heavy snoring when sleep no longer brings rest. Have you ever woken up at night for no reason, had restless sleep, or felt like you didn't really sleep? Has someone noticed that you snore loudly or briefly stop breathing during sleep? These could be signs that your kidney is quietly taking damage. Surprisingly but scientifically proven, kidney function and sleep quality are closely linked. When the kidney fails to filter toxins like urea, creatinine, or uric acid from the blood, these accumulate in the circulatory system and irritate the nervous system. This makes deep sleep difficult, interrupts sleep, or leads to sleep apnea, a widespread but often unrecognized syndrome. Researchers at Harvard Medical School show that people with impaired kidney function from stage 2 have a 2 to 3-fold higher risk of sleep apnea. This leads to oxygen deficiency in the brain, impairs memory and mood, and stresses the heart, potentially causing heart failure, arrhythmias, or strokes. Ask yourself, if you're tired despite sufficient sleep, wake up frequently at night, feel sleepy during the day, or experience nighttime shortness of breath and panic, listen to your body. If sleep is disturbed for no apparent reason, it could be the last warning signal of an overloaded kidney. Warning sign 8. High blood pressure and uncontrolled diabetes, the silent enemies of the kidney. It may surprise you that some signs are not consequences, but causes that silently destroy your kidney every day. The most dangerous are high blood pressure and uncontrolled diabetes, conditions many older people live with daily. The kidney has millions of tiny blood vessels that filter the blood. Persistent high blood pressure overworks, destroys, or hardens these vessels, severely impairing the filtration function. Diabetes causes high blood sugar, which inflames and clogs the kidney's blood vessels. Both factors weaken the kidney daily without warning through pain. The frightening thing is, Many only discover their kidney failure in the end stage, with only slightly elevated blood pressure or fluctuating blood sugar. They think medications are enough, but inadequate control permanently damages the kidney's filtration system. By the time it's discovered, a cure is often no longer possible. A 10-year German study shows that over 70% of dialysis patients had a history of uncontrolled diabetes or high blood pressure without being warned early that these are the main causes of kidney failure. Review your health journey. If you have high blood pressure or diabetes, don't just monitor the values on the device. Check your kidney function at least every 6 months. Only if the kidney is healthy will these values truly remain under control. These are the 8 warning signs that your kidney is crying for help. Some quiet, some vague, but all deserve attention. Crucially, they don't appear simultaneously, but creep in over months or years. That's why many only discover kidney damage when 70 to 80% of the function is lost, and a cure is no longer possible. You don't have to wait for pain to act. Listen to the small changes in your body. Sometimes, a small detail can save a life. A surprising truth. If you feel pain, your kidney may have already lost 80% of its function. The kidney is a silent organ. It doesn't hurt or scream like the heart or stomach. That's why it's critical to pay attention to the small signals described above. But recognizing them alone isn't enough. Even more important is how you can protect your kidney starting today before it sounds the alarm again, perhaps louder. The question is, how can you care for your kidney daily? Which methods truly work, and what silently harms your kidneys? One of the first pieces of advice from experts is to drink enough water, but not by guesswork correctly. Many older people avoid water due to fear of frequent nighttime urination, but this deprives the kidney of the raw materials it needs to function. Studies from the National Institute of Nutrition show that adults should drink 1.52 liters of water daily, with warm water preferred as it supports toxin excretion more efficiently. Don't drink it all at once, but spread it throughout the day, especially a glass of warm water in the morning after waking to activate the excretory system after the night. Another issue for many older people is the misuse of painkillers. Non-steroidal anti-inflammatory drugs like ibuprofen or diclofenac are often taken for joint pain or neck stiffness. Without medical guidance, these can damage the kidneys and cause acute or chronic kidney failure. Many patients end up in the hospital with severe kidney failure due to painkiller misuse. The solution: take medications only when necessary, always under medical guidance, and never use old prescriptions or follow word-of-mouth advice. Another underestimated harm comes from improper antibiotic use. Many antibiotics can poison the kidney at high doses, prolonged use, or incorrect combinations with diuretics or blood pressure medications. Always ask about kidney function with every antibiotic prescription, especially if you have pre-existing conditions like diabetes, high blood pressure, or heart problems. The body needs not only medications, but also movement to promote blood flow and support kidney function. No heavy exercise is needed. A morning walk, gentle cycling, or 30 minutes of Tai Chi daily is enough. Regular exercise has been proven to improve blood pressure and reduce the risk of kidney damage. Lack of exercise is particularly dangerous in old age, as it makes the body sluggish, accumulates toxins, and promotes chronic diseases. Perhaps surprisingly, nutrition is either a friend or foe to your kidney, depending on the foods you choose. Too much salt, red meat, or processed foods burden the kidney. Green vegetables, whole grains, fatty fish with omega-3, and low-sugar fruits like guava, apples, or cantaloupe are ideal. Low sodium is the top priority. Reduce salt, soy sauce, flavor enhancers, and ready-made meals. Use natural spices like ginger, turmeric, or black pepper, which flavor dishes and promote health. Regular health checkups every 6 months are one of the most important preventive measures for older people. Blood tests like urea, creatinine, GFR, or urine tests can detect kidney failure very early, even before symptoms appear. Many kidneys have been saved through early detection during routine checkups. A surprising insight. Chronic stress also harms the kidney. Stress hormones like cortisol and adrenaline increase blood pressure and heart rate, straining the kidney's tiny blood vessels. Living in worry, anger, or sleeplessness slowly squeezes the kidney. A positive mindset, social activities, meditation, and adequate sleep are therefore valuable protective measures for the kidney, free but invaluable. As you can see, protecting your kidney is not a distant task, but lies in small daily actions. With proper understanding, consistent action, and perseverance, your kidney remains a faithful companion into old age without the need for dialysis, blood filtration, or transplantation. If you've read this article to the end, I believe your health and that of your loved ones truly matters to you, and I want to tell you, the greatest value lies not in knowing, but in acting in time. Don't wait for a hospital visit to make a change. Start now. If you found this article helpful, subscribe to the channel A Healthy Life to not miss more valuable health content, especially for older people. Every subscription motivates me to share practical knowledge that helps the community live healthier and happier every day. Did you know that a kidney can be severely damaged without causing pain or clear symptoms? In this video, we share a special topic. Older people should know. The 8 most important warning signs of silent kidney failure. Signs that are quiet but could be the kidney's final cry for help before it's too late. Symptoms like persistent fatigue, swelling in hands and feet, foamy urine, dry itchy skin, or restless sleep could be warning signs of kidney failure, often mistaken for aging. Scientific studies show that early detection and prevention are crucial. In the video, we analyze each symptom clearly, explain the causes, and provide natural, safe tips for kidney care, especially for older people. If you or your loved ones live with diabetes, high blood pressure, or vague health complaints, you shouldn't miss this video. Don't forget to subscribe to the channel Senior Health Vista to continue receiving valuable content for a healthy, long, and happy life.